Hi, I am Dr. Sidharth Verma, and I will in this video tell you about back pain and what to do if you happen to have back pain. So, back pain is fairly common and it affects most of us at some point of our lifetimes. So, if you start having pain in your back, so by back I mean upper, middle or lower back. So, what do you do? So, for 1 or 2 days, if you have a pain of 1 or 2 days of duration, then probably you need not go to doctor immediately. You can follow some simple steps, and this can help you in getting relief from back pain. So, these steps are, first of all, you should analyze whether you have had any injury, because injury means that there must be some sprain or strain or maybe some ligament tear or injury which has resulted in this pain, because pain is a protective mechanism of the body. So, body is trying to tell you that there is something wrong somewhere, so you have to pay attention to it. So, if you have short lived pain with injury, then I strongly recommend that you should go to a doctor and get yourself examined. This is especially true if you are having other symptoms also, like you are having some tingling or numbness or weakness, or maybe some urine disturbances, or maybe some other symptoms like severe pain which is intolerable. However, if there is no history of injury and you are having a back pain which you think may be due to some stress or some strenuous exercise, or you are not sure of due to what reason it is happening, then you may follow the steps which I will tell you, and you can have a good amount of relief from your back pain. So, first step is we make a great mistake of resting as soon as we have back pain. So, by resting I mean that we often will call our office and tell, okay, I am not coming for 5-7 days, and maybe I will not even drive, not move. So, we immobilize ourselves. But however, this is not required in most of the cases, as if the pain is muscular, it is likely to even worsen by your immobilization or your giving a total rest to your back. So, then what to do if not to do complete resting? So, the first and foremost thing which you need to do is you need to correct your posture or your activity which has led to this back pain. So, you can start by analyzing your daily posture, you can start by analyzing your work, you can start by analyzing your diet. If you are overweight, you can start by analyzing your weight, and then you can probably have a relief from this back pain, as well as prevent the worsening of your symptoms. Another possible thing which you can do or try at your home is, and it is very simple, is you can improve the your sleeping bed or where you sleep in the night. So, often I have seen that patients, they sleep on greatly cushioned bed, and as soon as they lie down, the mattress just compresses and they feel very fluffy and very nice, but it is not good for your back. So, your mattress should be hard enough so that it is not easily compressed, and you, when you lie down on it, and you can easily lie on it comfortably, but it should not be very compressible. This is important, because while you lie down, your body or your mattress should be able to maintain the normal curves of the back. Your back has normal curves. So, if you can maintain them while you are lying down, you will be good and fine. Another common thing which you can do is to increase your water intake. So, if you are having you are dehydrated, you have more chances of worsening your back pain. Now, let us come to some common painkillers which usually people take in their homes or in their offices or in their workplaces if they have this back pain. So, these painkillers, they are drugs which are actually meant to give you short term relief from your pain, and they should not be taken for prolonged period of time without medical advice. So, although they are available over the counter, that means they are available to you without a prescription, but you should better avoid them, because excessive use may lead to harm, and this may lead to this may affect your systems like the renal systems, that is the kidneys, or the hepatic system, that is the liver. So, what kind of painkillers can you possibly take? You can start with the paracetamol or crocin, and the dose is for a healthy 60 kg adult, the dose is 650 milligrams once a day. You can start with it, and you can repeat this tablet up to maximum 4 times in a day, and once you repeat it, you have, if you have relief, then only you repeat. If you are not having relief from one tablet, then you are unlikely to have relief from multiple number of tablets. The role of this paracetamol is now very questionable, and some people have advised that since it will not help in the long run, so it should be better avoided. Another common drug which people take are some sprays which consist of a drug known as diclofenac. The common brand names are Volini, Daclogel, or Dynapar. So, these sprays, they actually diffuse through your muscles, so through your skin, and then they reach your muscles and surrounding tissues, and they help to decrease the inflammation and help you relieve from pain. Another thing which you can try is, if there is a strain or sprain or something, so in acute conditions, like if you have had an injury today, then you can apply cold on the region, and if you had this problem say for example in 3-4 days, then you can try applying heat, and this will help you to recover. And there are certain things which you should take care, that if these things are there, then you should immediately seek medical advice. These things are also known as red flags. So, if you are having back pain and you are having any of these things, then you should immediately go to the doctor. These include any fever, any neck rigidity, that is stiffness in your neck muscles, any nausea, vomiting, any weakness in your lower limbs or any part of the body. Then if there is any urinary symptoms or bladder symptoms, we also call it, and as well as any difficulty in passing the stools. If there is any seizures, that is if the patient is having seizures, so then also you should immediately try and visit the nearest doctor. If you do not do that, then there are chances that the condition will increase, and it will result in maybe increased damage over a period of time. So, to know more, you can visit my Lybrate website on www.lybrate.com/Dr. Sidharth Verma, DRSIDHARTHVERMA, and you can also visit my website on pain.org.in, pain.org.in. Thank you.